Good morning, everyone. How are you doing? It's good to see everybody today. Super excited for this particular topic, canine dementia. It's a little bit different for us, but I think it really applies as far as the mobility piece of what we do here, and how that fits in with the overall body. So mind, their emotions, your physical, your dog's physical ability to move around, and this particular topic I think really touches on a part of that. So I'm excited to talk about that today, and thanks everybody for being here with me. Appreciate that. I don't know about where you are, but it is cold and rainy here. And I'll say cold, it's like in the 40s and it's raining, which is something we don't normally see. Um, so it's nice to be inside. I'm not looking forward to getting in the pool today at all, but we'll get through. Dogs need it, and it'll be should be a good day. So let's get started. And this morning we are going to talk about canine dementia, canine cognitive disorder. It's got a lot of different names, but we're going to be talking about that today. My name is Titus. I'm from A Loyal Companion. The topic of canine dysfunction or dementia is one it's close to my heart, because it is such a challenge for pet parents to really. So I think we'll kind of through some of the challenges and maybe help you identify your dog is showing some of canine cognitive disorder or dementia. So let's get right down to we are going to be talking about today a brief overview of canine dementia. We're going to be talking about the symptoms, the causes, how it's diagnosed, and then how it's normally treated. And really, I'm going to have some tips at the end on what you do to help your dog who may be showing signs of having canine dementia or canine cognitive disorder. So let's jump right into there. So as I mentioned earlier, it has multiple names. So it can be canine dementia, canine cognitive senility, senile dementia. It's very similar to Alzheimer's that we see in humans. In fact, there's a lot of research that's being done both in humans and in dogs that will benefit both species, which is great. It's a fantastic example of one medicine, which is, we're all, whether you're a veterinarian or a doctor or a researcher, you're all looking for the betterment of all species. So being able to apply some of that research cross species is fantastic. So it's great to see those. So canine dementia is defined. It's a very broad definition. It's basically a host of behavioral changes that can't be explained by anything else. So it is by that definition, to diagnose it, it is a diagnosis of exclusion, which means it's not all of these other things. So we're thinking that that it could be this. So when we're thinking about it, really, this is one of those diseases that the pet parent plays a really big role in. So one of the ways that you can help your veterinarian diagnose this is to really be paying attention to your dog's behavior. And Helen's nose that keeps coming up under my arm. Paying attention to what your dog is doing or what they aren't doing, and taking really good notes and keeping that front of mind when you're working with your dog on this one. So there are 8 areas of behavioral dysfunction that veterinarians use to quantify and to qualify. So is it canine dementia, and how severe is it? So they're going to use these 8 categories, and I'll go through each one of these as the symptoms. And hi, Hesman, and go through there. So first one, fusion. So this is one. These are pretty obvious, and you may have noticed these. So we're talking about things like staring into space, having a blank look on their face, getting lost in the house or maybe outside, really not having a sense of where they are. Some dogs get stuck in corners, or they can't get around objects. Um, I've seen this multiple times where they will stand at the wrong door to go outside. Some may stand in front of a closet door that's maybe, maybe it's the coat closet right beside the door. They stand in front of the coat closet instead of in front of the door, or they stand on the wrong side of the door. Um, Another one is that's really can be odd is dropping food and not being able to find it, and it's right there, but they just can't find it. Sometimes you'll see a decrease in recognizing familiar people or other dogs. They're just not quite sure. They don't have the same level of enthusiasm that they may have had in the past. So being able to recognize those things. Another one, increase or decrease reactions to sights or sound. So maybe lights, or if you drop a water bottle, or you drop a book on the table and your dog just like jumps out of their skin, or there's no reaction at all. Both of those can be indications that, that reaction isn't quite right. So that's your first category. That is disorientation and confusion. Next one is how there changes in their interactions and relationships with people and dogs around them. So are they getting up to greet you? Now, this is one that we may have talked about as a mobility issue. So this is why when we're looking at canine cognitive disorder or dementia, we're looking for multiple elements, okay, within each of these categories, because not getting up to could mean too sore, too uncomfortable to do that. But in this case, there may not be any behavioral reaction to your entry into the room or to the house. They may not even notice, or they may notice and not have what you may think of as a proper reaction. Wagging tail, we all know our dogs smile. Is there that light of recognition and affection for when you come in the door? So we're looking at those. Your dog may stop seeking out attention, stop coming over when you're sitting on the couch, or needing to be petted, or wanting to be with you in the same room. Those kind of things. The dog may not follow you around the house as much. And again, this one, the seeking the attention, is one that you really have to be clear with your veterinarian on. When they do get up, are they sore? Are they stiff? Or do we have a mobility issue here, rather than there's not the drive to get up and be with you? The behavior has changed, not because there's pain, but because there's another reason, and it could be on the other side of the spectrum, they may be clingy and not want to leave you alone. They want to be with you all the time, underfoot, constantly, headbutting you, pet me, be with me, all of that. So it almost looks like an insecurity. So that's another one that you're looking to. On the other side of that, they may be increased in aggression. They may be irritable. They may not want to have anyone in their space. They're a lot less social. So there are extremes that we're looking here in all of these symptoms. So they're either irritated and agitated and don't want to be with you, or they're clingy and they don't want to let you out of their space. So you're looking for things that don't match their behavior. Okay, let's move on to the next one. And the next one is impairment in house training. So this is, again, one related to mobility and one where we're going to rule out other issues. So if a dog has a UTI or a urinary tract infection and constantly has to go to the bathroom, or maybe they're taking prednisone and they're drinking a lot of water and they have to pee a lot, those are the kind of things that we could identify as this is not a cognitive issue. That's because we've got a lot more water coming in, so we got a lot more urine coming out, or I'm so uncomfortable that I can't get there, or maybe nerves are affecting my ability to feel the fact that I have to go to the bathroom. So again, this is the diagnosis of exclusion. So we're talking about things like starting to eliminate pee and poo in the house when they don't have a history of doing that. And again, there's no other medical reason for that to be happening. One of the other ones that you may see happen is they'll go outside and they'll wander around the yard, and then they'll come right back in and pee. And it's like, what are you doing? That's not how this works. But that's a good indication that we've got some cognitive impairment going on as well. Another big one is eliminating in their sleeping area or their crates. Most dogs do not want to foul their nest, for lack of a better way to put that. They don't want to pee or poop in their space. So they're going to resist doing that. But again, if we've got some cognitive impairment, that doesn't matter as much. All right, so the next one, and remember, go ahead and ask questions if you have those. I'm happy to stop and answer some questions along the way if you'd like. So let's move on to the next one, and this is a really big one, and I think changes in the sleep and wake cycle. And I think this one, this is probably one of the most difficult ones to deal with as a pet parent. This one and the inside elimination that you're not used to. Because this affects your sleep and wake schedule as well. So what I mean about this is you'll have your dog may regularly wake you up at night with pacing, panting, anxiety, barking at what you perceive as nothing. They sleep less during the night, so they constantly sleep more during the day, which perpetuates that cycle. You may notice something called sundowning. So if you a parent who is older that maybe have early onset dementia or some Alzheimer's symptoms, you may notice this. And there is some clinical research that dogs do sundown. And let me define that. So sundowning is really an increased anxiety, agitation, fear of the changing light. It's that time just at dusk when the light is changing and it's going between the bright sunlight of the day and the dark of the night. That can be very disorienting for a dog with a cognitive disorder, and it's aptly named sundowning. So a dog who exhibits this is a sundowner, or one who sundowns. I have noticed this in my girl Helen. She has done it for, I'm gonna say, a good 5 or 6 years. We call it the witching hour, the spooky hour, and it's not a particular time of the day. And we've actually documented this, and we've watched her do this. But during once the sun hits a particular level on the horizon, she'll start to get nervous. She doesn't want to go for a walk. She's anxious. Her tail is tucked. She does not like that transition. I don't know if Helen has any cognitive dysfunction. We're not sure about that. We're actually looking into that right now, but that has been a constant issue for her. And I think a lot of dogs do this, and it's hard to explain. And it's hard to explain to your vet. And sometimes it's hard to narrow down exactly what's happening. But this is one of those things where it's good to keep a diary so you can write down what time it was that she started to act spooky. We call that the spooky hour. And we don't put her in that position any more than we have to. If we have to go out and we have to take her somewhere, obviously we can't avoid that. But the sundowning can be really disconcerting for you and for your dog, because they're not really sure what's happening when the light is changing. And this is a difficult transition period for them. So changes in the sleep-wake cycle play a very big role in diagnosing a canine dementia, and also managing how your dog does with the dementia. All right, let's move on to the next one. And this one is increased or repetitive activity. So in this one, we're talking more about licking the air, licking the owner, licking objects. Maybe it's pacing, but it's an activity that doesn't seem to have an intentional ending. So paw licking, pacing around the house, wandering aimlessly, just keeping moving. And they just can't get settled. And sometimes we'll have dogs that will do that until they literally can't do it anymore and they collapse because they're exhausted. They've been moving for such a long time. And if you're like me, we live, my dogs and my wife and I live in a pretty quiet environment, and to have a dog wander and wander and wander, just all of that movement and all of that anxiety just being spread throughout the room or the house, that can be difficult. I can't even imagine how difficult it is for the dog or the person who does these activities. We may also see this in an increase in an appetite. So that doesn't mean that they're constantly hungry necessarily. It may mean they eat more, they want to eat more all the time, or if you feed twice a day or whatever your schedule is, they wolf down their food. They just eat it as fast as they can. So the reality has shifted a little bit for them, and the anxiety around food has changed. So that is another symptom of the cognitive disorder. We've got, I think, 3 more here to go through. So the opposite side of that is decreased activity. So they may no longer be interested in food or treats. Maybe they have no interest in going for walks. They basically lose that drive. I mean, we've talked about emotions in dogs, and seeking is one of the big ones. It's that intellectual drive to explore their environment. And that can disappear or be significantly reduced. They just don't have any interest in exploring the world around them. They don't see anything as a reward. These dogs usually have bad coats. They've stopped grooming themselves. They've stopped shaking off. It doesn't, they're usually dry and dull. Maybe they get greasy depending on what kind of dog you have, but the coat changes, the grooming changes. And the last 2, anxiety. This is a big one. So usually manifests itself in vocalization. So barking. Barking is a big thing with canine dementia. It's the, hey, I don't know what's going on. Someone has to tell me what's going on. What are you doing? Or I'm not sure what that shadow is. The light has changed, so I'm nervous about that, and I'm going to tell you all about it. And I'm going to keep telling you about it until you make it go away or I figure it out. Again, this is one of the challenging things for pet parents, is having the constant barking. They may also develop some anxiety or fear or phobia of different sights or sounds. Or shadows and light. The changing of the light is another big one to keep an eye on. Fear of people, whether they know them or there's some anxiety or some fear there. The other big one is separation anxiety. Separation anxiety is relatively common in canine dementia. They do not want to be away from you, and you tend to be their one spot, their keystone that they can hold on to, and know, if they know you especially and they want to be around you, they're the clingy side of the scale, it will be even worse. So watching out for that. And then the last one is changes in memory and learning. So they may forget how to do a sit. They may forget how to walk on a loose leash. You may have shown them where something is, like their water bowl, and they forget where it is, or they can't figure out how to get there. You can show them which is the right side of the door, the correct side of the door to walk out, and it doesn't stick. Especially learning new tasks isn't really an option. They're slow to pick them up, or they can't pick them up at all. There's a sense that new information cannot be added, new tricks, new commands. Even if you're trying to reteach the ones they already know, that information isn't going in and staying in a way that can be processed and used in the future. That's all. That's it's just not there. The capacity to be able to do that is not functioning well. All right, so let's. So we've talked about the symptoms, those 8 symptoms. So let's go on and talk about the causes. And this one is going to be a very short section because we don't really know. Just like in humans, we're not sure what causes Alzheimer's, what causes the brain to deteriorate, and it does deteriorate in a similar way between humans and dogs. What we do know is that is an accumulation of a sticky protein on the brain in the gray matter. It's called a beta amyloid. That sticky protein, and it wraps itself around the neurons in the brain. So basically what's happening is that protein breaks down the neurons. So what you end up with is the brain has an interruption of the neurotransmitter. So the nerve impulse transmission. So being able to get from a thought process to actually making it through the brain action, and it's not the nerve impulse that starts all of that is interrupted and delayed. So there's not, it's like we can say, oh, how do we stop that from happening? I mean, there are ways that we can stave it off if your dog is diagnosed with canine dementia. But right now, we're not really sure what starts the ball rolling toward Alzheimer's or canine dementia. So let's talk briefly about how your vet diagnoses that. So we talked about those 8 categories of behavioral characteristics that help a veterinarian identify that. But again, it is a diagnosis of exclusion. So if you have 2 or more signs in one of those categories that appear once a week for a month, that is kind of the baseline on what a veterinarian will use to diagnose canine dementia. So whether it's a month or longer that those symptoms are appearing, that will help narrow it down. So if there's no other medical explanation for what's happening, there's no urinary disease, if you've got a dog that's eliminating the house, an infection, you don't have mobility issues, maybe severe arthritis that's keeping a dog from getting up to come and see you during the day, when you come home. When there's no other explanation for that, they're going to put those clusters of things together and treat it as dementia. So it's really, really important that you have a diary, you have a way to record what you're seeing, because you, dog's pet parent, mom or dad, are the one to play the biggest role in diagnosing this disease, because your veterinarian doesn't see what's happening at home. The staring out into space. They're not going to see the, going out and peeing right in front of the door. Not going to see that far. And you're to explain and express yourself and doing that and giving dates and letting them know how often this is happening. That's going to be key for making this diagnosis. So you play a huge role in this particular disease of being able to help your veterinarian get it right so that he or she can help you treat this and make your dog's quality of life the best that it can be based on what they're seeing dog medically. Okay, so let's talk about treatment and management now. And these that have a lot to do with pet parents' involvement in their dogs and how you can really set your dog up for as much success as possible based on what you're doing. So the first I think is the one that you have the most control over, is managing behavior and the environment. So when I talk about that, I'm talking about enrichment, things like enrichment during the day. So enrichment can be a walk outside in the sun. Light therapy, and I'm talking about like sunlight. There are lights that you can buy that project similar light to what you have outside. So in climates like Alaska, where they go, I think it's a month or 6 weeks without the sun, they do have special lights that help keep their circadian rhythm in working the way that it should. So enrichment during the day outside, if possible, structured social interactions with the family and with other dogs, if that's what your dog likes to do, and physical and mental stimulation. So the environment that in which they do all of those things should pretty much remain the same. I like to compare this to a dog who is blind, and sometimes you do have a dog who is having vision issues, and now the cognitive disorder is making things a whole lot worse. But if you think about the environment, it's a good idea not to be moving things around. Don't rearrange the furniture, even if you're trying to create more space for your dog to be able to do things or to move through easily. Really think long and hard before you start moving things around, because that is going to be really disruptive to your dog with canine dementia. So the next thing that you can do is their diet. So there are commercial diets on the market that are aimed specifically at dementia or cognitive issues in your dog. One of them is it's called Bright Minds by Purina. I think there are only 3, and that's one of them. There are only 3 types of commercial food that address cognitive issues with nutritional medicine, basically. You can prepare your own food and include things like omega-3s, fatty acids, SAMe, other things that you can add in that are over the counter. You want to be careful with making your dog's diet. You want to make sure you get everything that they need in there for the rest of their body. But if you are going to prepare a diet, I recommend that you get that from the veterinarian, and they can do that for you. But diet is another way that you can support your dog. Antioxidants are a big one. One of the problems with the brain is that there's some oxidation that's going on. So if you can stop that oxidation with, antioxidants, blueberry is a good example of that, but there are other ways to get that in. SAMe is another way to get some antioxidants in your dog's diet. So the last one is medication and supplements. So we're talking about things like SAMe, Denamarin, vitamin E, omega-3 fatty acids. Anapril is a medication that your veterinarian may decide is a good idea for your dog to be on. Another one is, if you are interested in holistic options, traditional Chinese medicine holds a ton of opportunity for dogs with canine dementia, as far as herb blends and being able to address cognitive issues through acupuncture, things like that. So don't rule that out. If you're open to those options, that could be a really good one. So finally, let's talk about living with a dog with dementia, and this is not easy. And I think you need to be patient with yourself, because this is not going to be easy, what you're doing, but you love your dog and you're going to stick with your dog as long as possible. So let's talk about how you can do that. Exercise, number 1, is essential. Your dog must exercise every day. Now, that doesn't mean you go for a 3-mile walk. That may mean you do 3 15-minute walks, or maybe you do 2 10-minute walks, or 3 5-minute walks. It doesn't matter, but your dog must move. And this is where I think the the combination or the rollover of mobility and cognitive health really come together. So it's important that we add a mental aspect to anything you do, exercise wise. So that could mean maybe you're doing some gym exercises that you're working on for mobility issues anyway. So those are a good addition of a mental exercise. Maybe while you're on your walk, you may decide to ask your dog to walk over a curb or walk around a street sign. Doesn't seem like a big deal, but it is. It's making your dog make a decision, use their brain to figure out how they're going to get from point A to point B. Maybe if your dog likes food games, maybe you go in the backyard, or if you want to go to the park, or maybe, wherever you need to do this, maybe you sprinkle some treats in the grass, or you take a snuffle mat with you and let them figure that out at the park. Whatever you do, exercise and mental stimulation need to go hand in hand. I can't emphasize that enough. You need to make sure that their food, their water, and their beds are easy to find. So again, we talked about not changing the environment on them, not rearranging furniture. God, if you can help it, don't move. Things like that. Don't change anything that you don't have to change for an absolute great reason. You want to keep everything the same. Sometimes you have to add more food and water, or maybe another bed somewhere in the house. If you're like me, I've got 2 dogs and like 10 dog beds. So they have a good opportunity to find where they're going. But making sure that those basic necessities for their health, so food, water, and rest, are available to them all the time, and it's easy to find. Multiple locations really are best throughout the house if you can do that. Next one, add enrichment. Even if you can't get outside, you need to create opportunities for them to use their brain inside. Now, moving things around is not what we talk about as enrichment. Enrichment is really more of something that is at their skill level right now. So you don't want to give them a level 3 game from Nina Otenson. You want to give them something that matches their skill level right now. So that may be a snuffle mat. If you're not familiar with a snuffle mat, think 1970s shag carpet on a grid, and you sprinkle treats in it, and they snuffle around to try to find that. We're actually conducting a class on Sunday for mental enrichment for mobility challenged or senior dogs, where we're going to talk about identifying what your dog really likes to do. What is their drive? My dogs are not ball dogs. They're not tug dogs. They're not toy chasing dogs. They're not retrievers. They're food motivated. So I know that. So the games that we play are going to have food elements in them. So if that is your dog, great. Learn different ways to play hide and seek with food. If your dog is really focused on you, play hide and seek in the house, play in the backyard, have you be the reward, you be the treat. You can absolutely get them to use their brain on that. Again, you want to make sure you keep it at their skill level. You don't want to create frustration and anxiety. You want to try to activate that seeking emotion as easily as you can without all the negative stuff. So don't make it too hard. It's okay if it's easy. If it's easy, great. Add a little bit of level of a progression of making it a little bit more difficult, and then see if you find a new level. But add the enrichment and do the enrichment that your dog likes. Focus on activities that they enjoy. All right, next one. Consistent routine, and this is really important with the sleep-wake cycle. So if you normally go to bed at 9 o'clock, make sure that you keep that bedtime. You keep your schedule in a routine. You keep your nighttime routine the same. Keep their eating and their food schedules, their potty schedules, their walk schedules. Those are benchmarks throughout the day for them. So making sure that you can keep those the same. You're not stretching them with surprises and changes in their schedule can be really, really helpful. It helps to reduce the anxiety and the disorientation of what's going on around them. You want to make sure that your dog is easily identified. Your dog should always have a collar with tags. They should always be chipped. They should never be outside alone. If your dog gets outside of your gate, your property, out of your house, out of your apartment building, they're going to wander and have no idea where they are. You want to make sure, one, you do your best to not let that happen, and two, if that does happen, you want to make sure that it's easy for someone to know how to get your dog back to you. So always collars and tags, always chipped, and make sure that you keep them close to you. Okay. So next, really understand that you have to adjust the care you provide over time. And this is the same for a mobility challenge as it is a cognitive challenge. So what you have to do today may not be the same as what you have to do in a few months or a year. It's going to change. So keeping up with those changes and being comfortable with those changes. Dementia is a progressive disease. There is no cure. We can't stop it. The best we can do is manage their diet, making sure they're getting the exercise, making sure they're using the brain. We can stave it off, using, SAMe or Denamarin or the Anapro, whatever your veterinarian recommends, keeping them as strong mentally and cognitively as possible. But it's going to change. And being prepared for that is important. If you have this is a family dog and you have children, or maybe you have your senior parents and your young kids in the house with a dog that has canine dementia, you must be very clear with everyone in the house that what the dog was like 5 years ago is not what they're about right now. So keeping everybody safe means keeping everybody informed and understanding the changes and the anxiety that your dog may be going through. So keeping that in mind is important. And the other really unfair element of this is that your dog may have, this usually happens to dogs between 8 and 10 years old is when we start to see the first signs of this. So at 8 to 10 years old, guess what else happens? Other things start to change in the body. So they start to exhibit changes in their health otherwise. Maybe they have kidney issues. Maybe they're having vision or hearing loss. So those things work to increase the level of anxiety. I mean, frankly, it's pretty unfair, but that's how that goes. So those diseases, along with mobility challenges, maybe like arthritis, which would be, one of your basics, is going to be there. So understanding that your dog has a lot to be anxious or irritable or cranky about is important, and that everyone in the house understands that they need to use caution and love and care in interacting with a dog who has canine dementia. And then finally, I can't emphasize this one enough. Your patience is probably the best gift. Your patience and attention are probably the biggest gifts that you can give your dog who has canine dementia. You love your dog. You love your dog that you had 5 years ago, or maybe 3 months ago, and now that dog is changing, but he's still your dog, and he still loves you, even though he may be lost in there. And it can be very difficult to rationalize that, to get that through your head. You want your happy-go-lucky buddy to go hiking with, or to sit on the couch and watch movies with. You want that dog, but that dog is slowly changing, and you have to slowly change and meet the needs of that dog that you have today, not the one you had 5 years ago, and not the one you're going to have in another month or another year, but the dog you have right now. You just got to stay focused on what you can do to help the dog you have today. And that may be different than what you had 3 days ago and what you're going to have in 4 days. So stay in the present, stay with them, and make sure that you're taking care of yourself. Okay. You can't provide care unless you put your oxygen mask on first. You can't help the other being. So having a good social network, a supportive network, is going to be important here, especially as your dog progresses into later stages of canine dementia. It will be difficult potentially. So being prepared for that and making sure that you're taking care of your own mental health is going to be really important for you to be able to provide care to your dog. We had one question about Nancy has asked about Prancer, about showing some of the symptoms, but also losing her hearing. So she has a good question about, is the increased barking due to that dementia or something else? So again, this is where we come into, thanks for asking that question, Nancy. So this comes into the diagnosis of exclusion. So remember, it's not always black and white. It could be both. So if you're seeing some added confusion as well, I think it makes sense to really, if you're not documenting, Nancy, you really need to be documenting so your veterinarian can address both and be as helpful as possible as far as improving your dog's quality of life. As far as maybe an anti-anxiety goes, there is an anti-anxiety a med on the market that I can't pull off the top of my head that does have some support for dogs with some cognitive dysfunction. So working closely with your veterinarian is the best thing that you can do, because there's going to be different ways to treat all of those things that you have described. But making sure you're clear and concise with what you're bringing to your veterinarian. On a personal note, we're going to be taking Helen to the doctor in about 2 weeks. And in the last maybe the last month or so, I've been taking notes about things that I've noticed about Helen. And Helen is 10 and a half, and she's a boxer Rottie mix. But we've noticed that I talked about her sundowning. We've noticed that has increased a little bit. Her anxiety is much more acute. I've noticed anxiety at different points. So I live about 6 minutes from our facility. And in that amount of time, she will have gotten underneath our hammock. We have a hammock in the back seat to keep her from falling in the footwell. She will have gotten underneath the hammock and tried to crawl into the front seat. And she's shaking so much that as we sit at a red light, the car is actually shimmering. So things like that, I'm trying to make sure that that I'm documenting as much of that as possible. I've also noticed some behavioral changes in how she interacts with dogs that she knows, but that she doesn't live with. Her reactions with Half Moon haven't changed much, but they have changed with a couple of dog friends that she sees once a week. She's more irritable. She's much quicker to go from 1 to 10 on a frustration level. And then there's no in between. And this is a dog who I consider my neutral dog, that I can bring in when I was doing a lot of therapy dog training. I could bring in and have other dogs walk past her. Sometimes I bring her into the pool room with dogs who are anxious about swimming, and she brings that energy level down a little bit, makes it a little bit less nerve-wracking. But that's starting to change a little bit. So I want to talk to my veterinarian about what I can do to support her, whether that's through behavior and environment, that's through diet, that's through medication, whatever I can do to help calm her on that. So we had another question on how much research is focused on canine dementia. So there is not a huge amount. What we're learning in the area is coming from work in human and dog models. So you're not going to find a ton of research, but I think what is there makes sense. Makes sense that this does exist. They've already shown it. They've already done necropsies or autopsies in humans where they can see the sticky proteins the beta amyloid on the brain in dogs in a very similar manner that it is appearing in humans. So the research is certainly not what it is for like a CCL tear. That's all over the place. You got plenty of that, but it's much more difficult to, I think, be able to accurately quantify research findings when we're talking about something that's based on cognition, because a dog, we can't give them a test that we would give a human with who we think may have early signs of dementia or Alzheimer's, because there's such a great variation of what the dog already knew, how to find that. Yeah, so then I hope that answered your question, Eileen. Next question was, I've mentioned shrinking world syndrome in other classes. Is this a symptom of dementia or something else? So I would classify that as something else. So I would look at that more on a depressive scale. So dogs that tend to be inside or in a single space for long periods of time, they start to lose the desire to explore once they're out of that area. So I would not qualify that as something that would be dementia based. I think that's a different setup than what we're talking about here. We have a question about calming dog music. Seems some dogs like it. Yes, I use Through a Dog's Ear music. If you Google that, you'll find they have many CDs and music collections. And they'll have their research to support why it works. It can. For some dogs, it does provide some calming for the anxiety, and that's basically what that is for. I use it for anxiety during thunderstorms for my guys, and it seems to work really well. I don't see why it wouldn't provide some support in these cases, but I would not expect miracles if your dog is barking every night at 2 a.m. that the music is going to calm them the rest of the way through that. But I think it can help with low-level anxiety. There's another question asked about research of using CBD oil for the support of anxiety. There's not a lot of research on CBD in dogs at all. There's a lot of personal stories and things that have worked, but CBD is a bit of a lightning rod right now in veterinary medicine because it's not legal in all states. The pheromone collars, like, and someone just asked about a pheromone collar. You'll have something called dog appeasing pheromones, or DAP. That has more research behind it than CBD. I think the jury is still out on CBD. I have used CBD for my own dogs, but for a different cause. But it tends to be the new coconut oil. It used to be everybody said, "Oh yeah, put coconut oil on it. Feed them coconut oil." There's not a whole lot of research in that either. So keep your eyes open for good peer-reviewed studies and announcements about CBD and what it could do. In some dogs, yes, it has been shown to work, but they don't have any research that says, yes, it is going to work. We've had a question about Adaptil. An Adaptil collar is basically DAP. It's just a different formulation. Yeah, and I think that is a good option to keep the anxiety level down as far as you can, for as long as you can before that escalates. I think what we see a lot of times is that the anxiety just ratchets up and up and up, and that's where you get the vocalization and just the fear. I mean, you can hear the fear in your dog's voice, in the barking and the confusion. So if we can tamp that down as much as possible, that's fantastic. I mean, you have to find that happy medium between I'm going to zonk my dog out on anti-anxieties and allowing them to experience the world as much as they can handle. And that's a fine line. And that's one of those, you want to have a really good conversation with your veterinarian. And I know it's hard right now, But you can have that conversation over the phone. It's much easier to have it in person, but that's not an option. So move past that, and have that conversation, have your list of questions ready to go. So when you do finally get to talk to your veterinarian, you're ready. Like when I go see my veterinarian, I will have a list of all of that I've put in my diary about Helen. Those will all be on a piece of paper, bullet pointed, so that she knows this is what I'm seeing. What do you think? And then we can have that conversation about what her diagnosis is and what may be going on, whether it's a single thing or whether it's multiple things, or maybe it's nothing. And I just started looking for this as I was researching this topic. Who knows? I mean, we're involved in this too, and what we see, we have filters as well that we put on our dogs, that we see our dogs through those filters. So your best bet, just take notes. Take notes, keep your journal, and keep an open conversation with your veterinarian. Okay. All right. Looks like that's it for questions. We're going to go ahead and stop for today. Thank you so much for joining me. I really I enjoyed talking to you today. And we'll be posting a list of topics that are coming up soon. We're going to try to keep our second and fourth Saturday of the month conversations going, and just stay updated. Also, we've got some new changes coming to our site. If you have a chance, go over to learn.aloyalcompanion.com. We've got all of our mobility chats are there, plus other helpful videos and class lists of things that are coming up. And we'll keep doing this as long as you want us to. I really enjoy doing this. So, all right, everybody, have a great Saturday. Go out there if you're somewhere where it's cold. Stay warm, stay dry, and we'll see you again soon. All right, thanks. Bye, everybody.